In a country where thousands of women die every year from childbirth complications, one rural hospital in Makueni County is quietly achieving something remarkable. At Kibwezi Sub-County Hospital, more than 1,700 women safely delivered in the hospital last year, and not a single mother was lost. The answer lies in a simple innovation, a heat-stable drug that works without refrigeration and calibrated drapes. Specialized tools that help measure blood loss during childbirth that guides healthcare workers to know exactly when a mother is bleeding too much. Our reporter, Emily Chabet, was in Makueni County and brings us a story of a smart solution to a problem that affects the most vulnerable in their vulnerable state.
Across Kenya, postpartum hemorrhage or excessive bleeding after childbirth is the #1 killer of mothers, with medical experts terming it a serious medical condition that claims thousands of mothers annually in the country. Professor Moses Obimbo Midadi, the chairman of the Department of Human Anatomy Medical Physiology at the University of Nairobi and the lead End Postpartum Hemorrhage Initiative, paints a grim picture.
About 3,000 women in this country die every year. That's about 10 women per day because of bleeding as a result of giving birth. And if you have to compare this figure, 3,000 women dying is like having 50 airplanes crashing and every passenger in that plane dying.
Postpartum hemorrhage occurs when a woman who gave birth vaginally loses more than 500 milliliters of blood, or when a mother who delivered through cesarean section loses 1,000 milliliters of blood or more within 24 hours of delivery. The uterus of a healthy woman of reproductive age is the size of a fist, but during pregnancy, it grows to the size of a basketball. Failure to contract back to the normal size after delivery is the main cause of excessive bleeding, though there are other causes.
For some women, the bleeding is a secondary sequel from low blood throughout the pregnancy. In fact, that's really the commonest cause. She was anemic, and then at the time of birth, she can't form blood clots.
Some of the uterotonics or medications used to make sure that the uterus contracts back to its normal size and prevents excessive bleeding are oxytocin and heat-stable carbetocin, which is a new molecule. Oxytocin, which until recently was the preferred drug, requires an unbroken cold chain to maintain a temperature of 2 to 8 degrees Celsius, making it difficult to achieve for healthcare facilities without reliable electricity or those that have no power connection at all. At the Kibwezi Sub-County Hospital in Makueni County, one simple change has saved hundreds of lives. Here, healthcare workers are not just delivering babies. They are delivering a new standard in maternal care, with tools designed for tough rural realities. The use of heat-stable drug called carbetocin, which was listed in 2019 by the World Health Organization as an essential medicine for prevention of excessive bleeding after childbirth, has been termed as a game changer. The drug is stable under any temperature, even as high as 30 degrees Celsius, making it suitable for arid and semi-arid counties.
Our deliveries averagely go up to 150 births in a month. And since 2023, I can tell you, we have not lost a woman due to bleeding after birth since 2023 to date. Not that they have not been bleeding when they come to us, but because we are well prepared.
The county government of Makueni has also adopted the use of calibrated drapes placed beneath mothers to collect and measure blood loss. No more guessing. The drapes are part of the WHO recommended treatment response known as emotive bundle.
Initially, we used to estimate. You can imagine just saying, I think she has lost about 200 mils of blood. And that made us to lose out on bleeding after birth cases because probably you have underestimated.
Makueni County is one of the counties that the government used for piloting the program through partners. Other counties involved were Nairobi, Nakuru, Kakamega, Kilifi, Migori, Kisumu, and Garissa.
A drug like heat-stable carbetocin has come in strongly to manage the issue of the uterus not becoming firm. And let me tell you, 70% of bleeding after birth cases occur due to the failure of the uterus to be firm. So once with this drug, you have already sorted the torn issue.
When we began using this drug, the people who really supported it were not even healthcare workers. It started with the casual workers, the cleaners, because every time you issue this drug, there is very little bleeding. And so they used to struggle to clean a lot of bleeding. Now they are not cleaning that amount of blood. And so as a result, they ended up calling it kausha.
According to Dr. Havim Bidi, the Chief Officer of Health in Makueni County, some facilities across the country are yet to adopt the new drug due to fear of the unknown.
Personally, I've used the heat-stable calibrated in so many patients and I've really not had any issues. But some of the side effects that have been listed include, a bit of nausea, headache, some patients get flushing, some patients feel like their blood pressure is dropping, but they're not really common.
The Ministry of Health has already okayed the use of heat-stable carbetocin to save mothers, but because health is devolved, the county governments are expected to procure the drug independently after its price was lowered by KEMSA from 2,500 to 92 Kenya shillings. And with evidence from Makueni, experts are hopeful that the numbers of PPH victims will fall drastically. Emily Chebet, Citizen TV.